So good morning, everyone, and I think it's good afternoon at your location. Thank you very much again for the opportunity to be part of this conference, which is unique in its mission, and it's actually very timely and critical amidst the pandemic that we faced in the world and we are currently facing in some part of the world. So the topic today is basically about data and the importance of data in healthcare quality specifically. So we'll start with basically the importance of data in healthcare, and then where basically the use of the data throughout the quality improvement process, and we'll probably finalize it with what we really need to take as a message in terms of our role and the requirements to really have a good information. To start with, there was a very interesting article which was published early this year in 2021 by Forbes. And there we can see that there was a very strong stress on the amount of data which is created, which is captured, copied, or consumed in the world every single day. And then only in past 10 years, this amount of data had been increased by 5,000%. So to put it into micro level numbers, we can say that every minute, every one of us generates around 100 megabytes of information. So if we look back in our online sources of data, we'll see 90% of the information is in the past 2 years only. Now, this is also very important in what we have experienced the past 2 years. So when the pandemic hit in 2020, early 2020, we actually needed two things. We wanted ways to limit the spread of the COVID, and we wanted to access the right information. So pandemics, they always challenge the infrastructure of healthcare, but COVID has added a new challenge. So COVID had added a new challenge. So that one of digital transformation and importance of information. There was something very interesting at the beginning of the pandemic where the World Health Organization General Director said, and that was a very eye-catching sentence where he said, we're not just fighting the pandemic, we're finding infodemic. And that means that leaders, they really required accurate data in order to combat the pandemic, in order to come up with a strategy to ensure safety of patients and safety of the population in general. So healthcare facilities, they are at the edge of acquiring very informative real-time data, and this is what we have seen. And we have done probably, I would say, a very good job because the data during the pandemic started at an individual or organization level, but then we could see within a 1 year time, we already had a vaccine. And this effort could not have been done without the actual information that had been transmitted at different levels of organizations and people. So the importance starts at various levels. However, there is something also very important which COVID did, and it is very important for all healthcare workers to be aware of. COVID came to expose our industry, the healthcare industry. What we have noticed that there was a new challenge in getting the aggregated data, the digital transformation of this important data that we have in hand. And more importantly, the real-time data means that we needed to have critical decisions to be taken, and we needed to take them at a timely manner. So you see, COVID had obliged governments, organizations, institutions, population to take very, very broad and mega level decisions, and we needed information immediately. So this was very important exposure that or probably awakening from the healthcare industry to be aware of. And what made it more challenging is not only lack of digitalization in some areas or lack of timely availability of information, but we noticed that our current infrastructure is outdated. We noticed that there is complex data storage issues. We noticed that data sources, disappearing the data source is important. And most importantly, we noticed if we have the data, we do not have probably the expertise or train the staff to really use this information which is in hand. So those important exposure that we had in the past 2 years, it's very important to integrate it into our day-to-day practice and see what we can do about it when we come in the next section to discuss more about the quality. An important thing before we move into the practical part of this conference is basically to look into the uniqueness of data that we have in healthcare. It's very important for individuals, healthcare providers, quality professionals. When they work with any data, they need to understand what makes it unique when we discuss the healthcare industry. So those of us who work with data, they tend to think in a very structured and very linear terms. For example, we like B to follow A and C to follow B, because we always trust numbers. And we don't want only this B to follow A, but we want to do it not just sometimes, but all the time, in every situation. However, what we learn in healthcare that data isn't that way. It's diverse, it's complex, and making a linear analysis sometimes, I would say, or most of the time, useless. So before we understand the importance of data in healthcare quality, we need to know the characteristics exactly. What makes healthcare data so unique, so complex, and nonlinear? So first thing is that much of the data that we use in healthcare is in multiple places. So healthcare data tends to reside in EMR, in HR software, with departments, with individuals. So data comes from all over the organization. So aggregating this data into a single central system, such a data warehouse, will be something that we really need to think about and something that should be accessible and actionable. So on top of being in different places, the healthcare data also occurs in different formats. You cannot go to a hospital setup or any healthcare organization and then look into one system and get the information, even if the institution is automated. So you will find somewhere text, other places numbers. You will find some of the data in paper, another data in digital. Some will be in picture form, others will be in multimedia form. So you'll find the healthcare data scattered everywhere and in different formats. For example, I could see automation in one, but radiology still uses images. Old medical records exist in paper format, and so and so. Second important characteristic of data, that data is structured and unstructured. For example, electronic medical record software gives us the platform to have a consistent data capture. But in reality, data capture is anything but consistent, because there is also the human factor that we really need to have in mind. For years, documenting clinical facts and findings were on paper, and everybody in the industry is trained to do this on paper format. And then bringing this information into the digital, it needs a change in the mindset. So this is an important factor that we really need to have in mind. So that's unstructured data capture is often allowed and by EMR users, and it makes the delivery of care sometimes difficult. The third very important characteristic of healthcare data is that it is inconsistent. And it is under the impact of evidence-based practices. For example, one group of clinicians may define a cohort of asthmatic patients differently than another group of clinicians. Or when you ask a clinician what criteria are necessary to identify someone as a diabetic, you might get 3 different answers. There may just not be a level of consensus about a particular treatment or cohort definition, and this makes things more complex. Also, even when there is a consensus, the consenting experts are constantly discovering new knowledge. There is best practice established in the industry, but there always also discussion in how we do things, how we define things, which means you're trying to create order out of chaos and hit a target that's not only moving, but seems to be moving in a way that you might not predict. And that's what evidence-based practice does with the information and data that we have in hand. Fourth, the data is complex. So claims data has been around for years and it has been standardized, but this type of data also is incomplete. Clinical data from sources like the EMR give a more complete picture of the patient's story. But while developing standard process that improves quality is one of the goals of the healthcare, the number of data variables involved makes it very, very challenging. So we really need to have that in mind. And last is data is always subject to regulatory requirements, which keeps on changing because of research, because of evidence-based practice, and this shifts the whole a reporting burden of organizations. So this might be probably hard to digest, but when we look into data, we really need to have all those unique characteristics of healthcare data that we have in mind when we move into more practical application and try to use this in the process of quality improvement. Now, this is a very, very important slide. When we talk about data, we think that that's it. We have the numbers and this will be more than enough. So in reality, data refers to a discrete set of details, which is related to a situation which we might encounter in healthcare, related to a patient, related to a process, or related to a population. But if you think of data as an isolated island of facts coming together, you will not be really get the full picture. So what we do usually when we bring the numbers, we try to add a meaning so that whatever result, whatever numbers that you have, you really need to process this, structure it, categorize it, trend it, so that this number, when you add a meaning to the number, it turns to be an information. So information and data is not the same thing. Data is the raw material that you have in hands, on which you add your own experience as a quality healthcare providers or healthcare providers, where you use your experience, you use your judgment, you use your knowledge to add on this number, look at the number in more processed way and translate it into information. Only when you do that, it will be able to guide you to next step, which is acquiring the knowledge, means that it will arise when information that you got, you understood, you put a meaning to the number, it's more synthesized and it's more interconnected. You start looking at the information when you put another information next to it, and then this will be converted into knowledge. Now, knowledge definitely involves recognizing patterns, trends, abnormalities. So that's what we and healthcare quality, we're very keen to look not to an isolated number or case or an information, but start putting bits and pieces of information together to translate it into knowledge. And that's where the value of having somebody experienced is, trying to put different departments. That's when we talk about quality culture. means that we are trying to build this information into various departments, processes, or with various entities. And then as a quality, we glue all this information together to translate into knowledge. And the last, which is extremely important, is when you use this knowledge to take an action. And that's where the wisdom comes, because this knowledge, then you understood, you analyzed well, you put it against processes, against patterns, against evidence-based practice, and there where you took actually the action. And that's why the use of data, excuse me, to help you in translating the number into actual wisdom and decision. Now, let's take this into more clinical example. Imagine that I would give an example from a department I work closely, which is nursing. Let's say a nurse takes the height, weight of a patient and then looks into the blood test. She might notice that the patient has a slight increase in glucose tolerance and probably slight increase in cholesterol level. For this initial numbers and facts, she's looking at the data. But this alone will not mean anything. Then the nurse discusses the result with the patient and invite him for a second visit. After a second visit, a blood test will show a higher glucose level and probably same high cholesterol level. Now, what she does is that she takes this test result as an information and upload into the system, into the MR, and takes a family history where she will note that the patient has a family history of diabetes. So now the nurse, she has the data, and then she has an information of the family history, and she brings this together to understand that the patient is actually at risk of having type 2 diabetes. Now, thinking about this diagnosis as a risk, it's a knowledge. So she brought the data with the information of family history, combined together and came up with a diagnosis. So that's how we see that the data will be evolved from an information to a knowledge level. Finally, I would say she needs, and that's what the use of data is, to take an action, to take a decision. She decides, for example, she hands over the patient a plan of care for 6 months to lose weight, to control diet, and then come back in 6 months' time to decide whether this was responded to the plan of care or referred to a higher level. So this is wisdom and this is decision making. So this is a simple process that we do in every single department, and we need, as healthcare quality providers, we really need to understand and direct everyone in that step of moving the information or the number and ask the right questions and bring the right information to escalate it to a higher level, which yields to a decision taking by the person who is involved in this. So saying so, this is the raw use of data. But when we bring it to our healthcare facilities, in context of hospitals, in context of clinics, we look into it into more practical way. Where do we use this information? What's the benefit of having data which is translated into action? So we start using it from the population. We don't look only to the healthcare scope that we're providing, but we look into the population in general. An example of this is, for example, the project I'm currently working is having secondary hospitals for a population we're serving in the country. So the first thing we look is numbers of diabetic, the demographic of the population. So all those numbers is actually comes in with an information and translated into designing a hospital, designing the processes for the patient safety, designing the workflows. So this is the information that we bring and then add to it various information and work. Population also, as we said, it's important data for disease management. This is something extremely important for quality healthcare providers. That's where our KPIs comes in. That's where our preventive measures starts in. That's how we plan safer patient journey into the facility that we are looking into. So continuity of care of patient is not within also the facility that you are working. As healthcare quality providers, we look into the community, where they're coming. And I think COVID was an excellent example of looking beyond our facilities and looking into the disease management of patients who are coming to our facility, but coming from the community. Also very important for us is the patient experience. This is one extremely important scope for healthcare quality, and data is extremely important when we're analyzing patient experience. And as you know, that experience does not start when the patient is admitted or the patient enters your facility. It starts before, where the patient is in the community. So that's where this data, which flows from the community back to the institution, is important for us as healthcare quality officers or managers. Improve the service delivery, improve operational efficiency. This is in terms of where you have the information and you want to disseminate, but also it helps us to identify, project, predict risk, reduce costs. So it goes beyond the patient, it goes to operation side. It helps us in research, and then eventually all this information helps us to come up with policies and procedures at regulatory level, in terms of agencies, in terms of ministries, in terms of national standards. So the data that we have in hand is extremely valuable in moving the direction at a national and at a global level. So do not always think that you have a standalone organization, but everything happens, every number generated in that standalone organization ends up at a very higher level, at a more macro level, to come up with regulatory measures. Now, measuring quality is our topic. We had discussed in general how we can disseminate this into departmental level, organization level. We now need to know that this high-level information, how each one of us can disseminate back to his department and back to a PDCA cycle that we work in quality on. So we know that, no doubt, that quality improvement is now the driving force in healthcare, and it's an essential aspect of service delivery at all levels. Just putting it simply, quality, we know it's everyone's business, from the leader who's leading, from the board probably, to down to every single person. But unless we rightly measure, it's difficult to say to anyone how exactly we had improved, and not only how far we came with improvement, but whether we in fact achieved the improvement, whether it's a system or it's a process without the right information. So data not only enable us to accurately identify a problem, but also it helps us to prioritize the problems. It helps us to enable to come up with an objective assessment and change and measure the change that we had introduced. So collecting and analyzing data, they are the central function for any quality department anywhere in the world. But how do we accept the data that we have? Is any data okay with quality? Can we add just an information on that and we can work with it? Actually, no. Sometimes having the wrong data, it's more detrimental. It will significantly have a negative impact instead of not having an impact or positive. So it's very important for us as healthcare quality professionals to first question the data before questioning the content and before understanding that data. Before we act, the first thing we do is we have to determine whether this data in hand is a good data. And that's where we start our first important task as quality professionals. So how do we determine the data is right? So we have many dimensions that we work on, but 6 are extremely important. First, we have to know that the data in hand is complete. This is a degree to which necessary data is available for use. And that's one of the challenges that we had mentioned earlier, which we faced with the pandemic. We did not have the full data in hand for decisions to be taken. So this is an important dimension. Second is that data needs to be unique. And it cannot be mistaken for other entries, so that's very important. Data has to be consistent, so it should be, it's the degree to which the data is equal within and between data sets. It needs to be valid, both internal and external validity. It needs to be accurate. It represents the actual reality. And data needs to be timely. It needs to be available when needed. And this is, again, another challenge we had with the pandemic. And we saw the repercussion it had on mass population. But what do we do if we have the good data? So it comes to our department, any information. We know that data is the raw material from which information is constructed while we process and while we interpret. And this information in turn, it's very important, as we mentioned earlier, that it's translated into knowledge upon which we build our decision and our action. So the wisdom is where we can decide and we act based on this decision. What we do with quality improvement is we look at the data in 2 terms, in terms of pushing the information or the data and then pulling it out. And this is something extremely important. So data will be pushed quality improvement. It will help to decide where is the problem, how to identify a problem, how to analyze a problem. However, what we have to do as quality professionals is actually pull and help to identify and analyze those opportunities which will lead to improvement. So our role as quality professionals is not only bringing the numbers, is actually pushing this data and then understanding it so well, look into reliability, look into validity of this information that we get, we analyze, and then eventually convert everything we have into hand into opportunities for improvement. So this push and pull is extremely important, and it's not the same thing. We have to be very critical at first stage, whatever we're pushing, to make sure that whatever we're pulling is the right one. So the input is always has to be balancing the output. So you cannot have bad data and then expect that you will end up having a good improvement plan. So this is an important first step that we have to note. Now, to understand our role and the importance of data that we have at a departmental level, as a quality in any single stand organization, we look importantly to look into the data throughout the 5 phases of improvement cycle. We are all familiar with this improvement cycle, but we have consideration at every single level differently. And then putting all these things together, we can come up with the right improvement plan. So first stage in our cycle is the definition, the project definition phase. This is where we ask the big question: what's the problem? What's the question? What is the priority? Where is the risk? So this is where we ask the question. And then here we need the right information to really start thinking. We look at numbers. We really need to assess the current performance. So we really need numbers there, data. We really need to have opinions where we translate it. We really need to have priorities. We really need to have aims and targets and benchmark. So this all help us to come up with the right question. Clinically, this can be translated into anything that you encounter in your day-to-day life. For example, how do we improve the use of blood products in the operating theater in line with new clinical guidelines? For example, why is post-surgery infection rate very high in this department? Another can be, are your patients satisfied with the waiting time in the ambulatory area? So those are the questions which comes, you really need data, but this data alone, as we said, will not be enough till we move to other phases and try to translate with other information that we have. This is an example of what we look into at this phase. We all, I'm sure, in our organizations, we work within the quality domain or the criteria, and it differs from country to country, it differs from organization, it differs from accreditation body to accreditation body, but somehow I would say 90% of the time we speak about the same dimensions. If, let's say, you're taking the dimension of effectiveness, then your data will be looking into the KPIs that you have, that you are monitoring. Your data will be the benchmark against other facilities or against other services. It might be a report from morbidity and mortality meeting. So those are the ways that we will practically take this data and look into and bring it to next level. Next level, which we come, is the diagnostic phase. And this is the phase that we mostly ask the question, what can we improve? So you get the data, and this is where you are bringing other information. So you are extending this information that you initially alerted you, and now you have to build on it by bringing more information. Usually here what we use is many techniques. We do brainstorming, we do process mapping, surveys, audits, control chart, benchmarks, clinical guidelines. So all those things comes together to really take you to this level where you have to add more information together, more data to come up into an information process. A practical example for this will be probably process analysis. For example, establishing triage procedure to prioritize your urgent cases. You might have bottleneck in the emergency, your waiting time might be very high, and then you want to put a triaging process. So here is where you got your first level, problem level data, and then try to know what to do, what can you do to improve. Another can be, for example, you might have in an ambulatory area failure to attend high rates, and then you decide at this phase with the what question is to remind your customers of the appointment, send them a text message or call them. So this is how we move with the data at this phase. Now, third phase will be the intervention phase. It's not what to improve. Now you're asking the question, how can we improve? So with this, you really need to have different set of information, and we are building the knowledge base now. So with the intervention, your data is to check your priorities. It needs to formulate your intervention. So you will have the ability here to select the appropriate intervention and the implementation strategy. And it's very, very important at this phase to really make sure you have the good data, the reliable, the complete, it's available on timely basis. So this is extremely important. And excuse me. And here might be also how we can improve. You can integrate this into your process mapping. You can, for example, decide practically to train staff, educate on central triage system, the example that we gave earlier. So you had your triage, now you are you want to know how to improve. So you work more with the information that you have in hand. So you see that we moved from the data within our PDCA cycle, slowly taking us into knowledge and decision and action level. The fourth phase in our cycle, in our PDCA cycle, is the impact measurement phase. So this is a very important phase because we ask the question, have we achieved our improved plan? So what and how now has to come up to see whether it worked, yes or no. So the data at this phase is to determine the impact of the change that we have initiated and to demonstrate our next phase, whether we can move on with this improvement plan or we have to introduce changes at this certain phase. And here we can use many data tools, we can use audits, we can use surveys, we can use interviews, focus group that we all are aware of. And practically, if you want to, for example, give an example of this phase is basically when we usually introduce any new process. For example, you had high DVT rates in your ICU and you established a guideline. Now you want to come and then collect data to determine whether whatever clinically you had introduced is really in line with the guidelines and it's really having a clinical impact. So this is more advanced phase where we come and check our decisions, numbers and data against our decisions. So you will also, at this phase, very important to be able to articulate the benefits and the outcomes of whatever initial data you started with to bring you to this phase. The last, I would say, and bear me, we only have 2 more slides. The last is sustaining whatever you do. And this is everybody in the quality know very well that even if we have a successful improvement plan, we really need to make sure that this is sustainable. So outcomes and process, whatever targeted result they gave us, sustainability is the key here. So here you use data to guide your sustained improvement. It can be monitoring, can be ongoing assessment, or it can be a periodic assessment. So you decide based on the situation in hand what type of measurement you need to really implement, whether periodic or ongoing. So this is basically what we have in hand when it comes to data and quality. I'm sure 20 or 30 minutes will never be enough really to stress the value of data that we have in quality. However, we can always think that data alone is of no value unless we put the right information and we really get the right knowledge to take a decision with this data. We have a very important role, leaders, they have very important role in this, in creating a learning culture, because we enter organizations with certain knowledge, with certain skills, but this needs to be developed ongoingly. There should be always, we really need to try to close the gap between the skills that we come and the knowledge that is there. And this can be created by capacity building, can be created by learning culture, by creating quality culture in the organization. And recently we noticed by automation. So technology is not a dimension that we can take, despite all our intentions, good efforts. If we do not have the right technology to help us in processing this data, it will be difficult really to make the best use of it. These are some of the references that I had shared with you. They're very interesting, they're very recent, so it can help you, whoever is interested. I'll be able to share with the organizers of the conference for you. And if any other information required, I'll be more than happy to share with any one of you. Thank you very much for participating, for listening, and for patiently accompanying me through this presentation. Thank you.